This video provides examples of the ePrescribing state law on demand from Point-of-Care Partners or POCP. In the next few minutes, you will be given an overview of what the product includes and how it's delivered, followed by a demonstration. State law on demand is a research brief that covers the current state rules and laws governing electronic prescribing. It begins with a memo from the editor describing the latest regulatory trends. The memo is followed by the highlights of the most significant updates from the previous quarter, followed by tables that provide a 50-state at-a-glance view of regulatory requirements for each of 7 topics. The first topic table addresses printed formats of prescriptions, such as how many signature lines are required, specific text that must be on the print template, and other rules that impact what the prescription must look like. The second topic table addresses modes of prescription delivery and includes things like EPCS mandates, e-faxing rules, and also has information about states that require a unique approval process for ePrescribing systems that will be operating in that state. This next table describes prescription drug monitoring programs. This has been a volatile topic for regulatory changes in recent months. Many states now mandate that prescribers must look at the patient's PDMP report before prescribing any controlled substance. Others require it for certain drugs under specific circumstances. On Demand also monitors if delegates are allowed to look at the PDMP on behalf of the prescriber, and if so, how many can be designated. A growing area of interest that is monitored is that states are implementing policies to encourage the integration of PDMP access into EHRs or the state's HIE. Legislatures have also been very active lately with placing new limits on how controlled substances may be prescribed, and there isn't a consistent pattern with how these limits work. We're seeing quantity, days supply, and refill limits defined for particular drugs or drug classes, and unique limits if certain drugs are prescribed in combination. Limits may also be determined by the patient's diagnosis, type of pain, or the location setting. These variable criteria create a challenge for prescribers to keep track of it all. Also monitored are rules for when prescriptions expire and for out-of-state prescriptions. The Mid-Level Prescribing Authorities table describes the unique requirements for physician assistants and advanced nurse practitioners. Many states require these providers to have their supervisor information on the prescription, and also mandate additional certification IDs to be present. Some also limit or prohibit the prescribing of controlled substances. As the FDA approves biosimilars, states are implementing new rules to specify the parameters of substitution for biological products. The trend is that states require the pharmacy to notify the prescriber that the substitution has occurred, preferably via electronic means. Each state defines the time frame within which this notification must occur. Many states are more restrictive than the DEA when scheduling certain drugs. Our schedule variances table tracks those differences so that vendors can assure that EPCS and other requirements are properly implemented for these scheduled drug products. We also track if non-scheduled drugs must be included on the PDMP. Point-of-Care Partners has 2 ePrescribing state law offerings, including this one, the State Law on Demand, and our flagship service, the ePrescribing State Law Review. You may wonder how you can determine which is best for your needs. On Demand offers the most flexibility and is our budget-friendly option. It's purchased as a single report, which is a snapshot in time of the most recent state requirements. It's updated and republished 4 times a year and can be bought as often as needed. For some, a single annual purchase is satisfactory, perhaps to support an annual compliance audit. The Law Review is sold as a perpetual quarterly subscription, provides immediate alerts for significant updates, and includes more detailed analysis and full-text citations of laws and rules. It also includes direct access to our expert regulatory research team for client-specific questions and regulatory impact discussions. With this premium service, you will always be up to date with the very latest revisions and prepared for oncoming trends. If you find that you need more than what Law on Demand offers, contact us and we can discuss how the law review solution might work for you.